So proud to be here and talk with you. So you see the title, The Black Hole of School Avoidance, Case Examples and Strategies to Move Ahead. And a bunch of you have grabbed me over the last couple of days and said, oh my gosh, Nancy, I'm struggling with a school avoidant kid. Love to hear what you have to say. And for 80% of kids with school avoidance, we know what to do, and then there's that 10 to 15% of kids where it can seem intractable and where it's permanent and pervasive. We lose sight of learned optimism, Seligman's idea of positive psychology. So when I was thinking of a glimmer, I wanted to start out our talk today with a student. And a student who I teach a Harvard freshman seminar. I get these really inspiring students. And I had asked the class to write something for a student who was discouraged. And Sana Shahul wrote this beautiful spoken poem. So we're going to start out the conference, start out this discussion with a glimmer. So if I can ask you to come up, thank you. You've got this.
Hi, everyone. I'm Sana Shahul, and I'm going to be reading A Meteor Always Looks Better at Night. I know right now it feels like you are hanging on by a thread, that mornings have become something that you dread, that staying alive is more a curse than a blessing, and you're still trying to figure out why the sunrise is so depressing. I want you to know that your presence in this world matters, and if not to you, then to me. You don't know who I am, but I know who you are because I see it. I see the struggle within you, and it is burning so bright that you think it might burn right through you, but instead of becoming ash, you will become a phoenix and rise like the sunrise that no longer holds you back. And if you think about it, a phoenix on fire is like a meteor. So embrace the red and shine right through the night. Wish upon yourself because you are a star. And in the process, you will realize that so many people are wishing upon you too. So use your red hue because other people deserve to be graced by your light. Other people are mesmerized by your fight. And in the process, you will realize that you are someone else's reason for believing that there is good in the world, that you are a breath of fresh air in a world that constantly seems to be underwater, that you are someone else's reason to stay alive, that you are someone else's reason to smile at night. So I know you don't know who I am, but I know who you are because I see you. I see you shining every night, and I recognize your fight. Thank you.
So today we're going to cover what school avoidance is, why certain students are missing school. We're going to have a case of an elementary student, and that will be an opportunity. I'll present it. I'm going to flash the questions before I first start. This is called previewing. Sarah Ward would be proud of me. I'm going to flash the questions as I present it. You can be thinking about it, and then I'll put the questions up again, and we'll have 10 minutes to discuss, and then I'm going to have some quick volunteers share some of the responses they might think of, and then move on to some other thoughts that I have about it. Then I'm going to spend about 10 to 15 minutes about what decisions schools need to think critically about. So that part of it is if you have an attendance group, which I would really encourage us all to have attendance groups, you can bring back some of these questions and, to borrow from the DBT language, cope ahead. Right. Then we're going to have brief interventions about connecting and documenting. And then we're going to have a second case. So we're going to move from an elementary school age kid to an adolescent. And then we have Marc Banks. Marc Banks is sitting right there. Some of you know from Newton South. If any of you are from Newton South, shout out. And he is an amazing administrator. I've been working on a situation, a pretty intractable situation for a year. And sometimes when you're in those situations, it can feel like you're moving the chair on the Titanic. And his faith and dedication really inspired me. And I wanted us to hear from an administrator about what kind of commitment and what are some clinical pearls that he could give. And then we're going to end it with talking about family therapy and the outreach to family. So we got a ton to cover. That's the bottom line. Okay. What is school avoidance? Well, first of all, it's not in the DSM, and that's because the Diagnostic Statistic Manual is pretty useless when it comes to practicality. And sorry. So what if 30% of kids are not going to school, and that just gets glossed over because it's not revenue generating? I don't know. But there are multiple overlapping terms. You've got chronic absenteeism, school phobia, school refusal, school avoidance. It's kind of like when you have a kid that's struggling. Do you notice the kids who are struggling the most have the most number of letters after their name? And I don't know if the distinctions are real or not. What we do know is that there's been a difference between school refusal and truancy. Basically, truancy falls into the category of sort of oppositional defiant disorder, that this is a kid who is willfully missing school, and school refusal is about kids that are usually anxious, the parents know about it, and they like being at home often. And but really, the million-dollar question, I think, is the desire to avoid something in the school or to stay at home? And of course, many of us would say, Nancy, don't you know about both and? But usually I think there's one part of this that's really weighing in. And this is just to say the pandemic was a bust, and it did not make school avoidance any better. Quickly, what we know is that there was total confusion about, do I come to school, do I not come to school? There were confusing messages from school, and we saw a lot of regression. And it's astounding how many students are still recovering from not being at school. And just a sort of poo-poo platter of why certain students miss school, and we're going to concentrate more when we get to the cases, but it's just to sort of get us thinking, is clearly kids with adverse ACE events, adverse clinical events, traumatized kids are more likely to miss school. Kids with learning disorders, particularly that haven't been diagnosed, and many times school-avoidant kids don't get a diagnostic eval through our comprehensive core, and we sometimes come in too late. Sometimes there gets to be the blame game, and then we heard from Justin in terms of the kind of bullying and school culture that can make kids decide not to come to school. And then family factors, one of the things I would highlight is high conflict divorces. Often, if you want to see a kid torpedo and not come to school or start not to do his work, it's in these high intensity divorce situations or conflict, and then permissive parenting, which I always wish we could come up with a different word than permissive parenting. It sounds somewhat judgmental, I've been reading, of course, about school avoidance because I get stuck too, and I'm looking for paradigms. And I have to tell you, there's not much useful out there. There's a guy named Keeney who likes Kearney, Kearney, sorry, Dr. Kearney. But, he has sort of lists where he'll say, let's look at the target of behavioral observations immediately before school. We can look at anxious behaviors, sometimes parents doing excessive reassurance seeking, aggressive or disruptive behaviors, parents' reactions to child difficulty where there's increased anxiety or conflict, and then school official reactions.
Okay, I'm going to talk to you about Jenny, and you're going to be thinking, what other information do you need? How would you respond? How you would support this student in returning to school? And what obstacles would you anticipate? And how would you address them? So that's the questions that you're going to be asking yourself. And this is the case.
We have a first grader. I want you to be thinking about the questions that I asked you, right? A first grader in a mainstream bilingual program who has large tantrums after separating from her mother at school. And this is including foaming at the mouth, throwing her body at the door, and running out of the building. And she ends up, the first incident, she tried to run. The school psychologist put her hands on her shoulder to stop her and to escort her to her office, one door down. In the office, Jenny pushed several times, trying to run out of the room. Jenny kicked her and was placed in a restraint that lasted for 11 minutes. While in restraint, Jenny attempted to kick. Jenny dropped her weight to the ground after Jenny crawled under tables and attempted to leave the room. Jenny was able to calm down when presented with bubbles. She used her bubbles to calm her breathing. And then she felt ready to return to class, but when we walked into the hallway, she attempted to run. Her teacher was called, and when her teacher arrived, Jenny was told that recess had started, and she was able to calm her body and go with her teacher to recess. Then I'm going to leave you with this last part, and then I'm going to ask you all to discuss at your tables together what you would do with those questions. So she got sent to the emergency room because she had, again, had another incident where the principal was asked to assist because they were struggling to get, her mother was struggling to get Jenny into the building. And when they brought Jenny into the building, she hit the assistant principal's arm, leaving a bruise, and she was put into a hold for 5 minutes with the principal and the assistant principal. She escalated with headbutting, biting, and kicking, and was put in a hold for another 6 minutes. She was calm for 20 minutes and then tried to pull down the shelf and was put on a hold again. What she said is, "What are you scared of, a little girl? She's so cute, though. The only reason you like me is so you don't get fired. This is not my problem, it's your problem. Fuck you, there, I said it again. You aren't the boss of me, fuck off." I don't know if any of you have heard this language before, sorry. "Why don't you just kill me then? I'll be calm. I don't care if I hurt you, that's your problem." So, Jenny was sent, she was sent to the ER, and she's been home, and the parents want her to return to school with accommodations, and the school is concerned about the ability to keep Jenny and staff safe. And this is the email from Jenny's mom. "The school psychologist wants me to meet with Jenny's teacher and me and whoever else. I'm happy to meet, but I'm afraid, terrified, that this is another situation where I am supposed to give them solutions that they ignore for problems I can't really solve because I don't work there, and then get blamed for the whole thing. It's possible I'm overreacting, but I feel I have lots of evidence that overreacting is appropriate." So I'm going to give you like 7 to 8 minutes, or let's say 7 minutes, just to think together about the questions that I asked you. What other information do you need? How would you respond? How would you support this student in returning to school? And what obstacles would you anticipate? Okay, 7 minutes. First of all, I want us to give a hand before they even start to talk, because it's a lot of courage to get up here. And we're going to just start with Jenny. What other, that's fine, we were good with one, we'll pass along. What other information would you need?
We talked a little bit about, we think we would need to understand a little bit of that psychosocial history, any medical information, how she was the year previously. We're interested to know a little bit more about the relationship she has within the school building. Who does she have a relationship with? Who can have a conversation with her and we can get some more information in terms of what exactly may be going on in her head that's causing her to respond this way. Clearly, she's having a very extreme reaction. She's scared about something. We want to know more about the family dynamics, the relationship there. How is the parent responding to this at home? More about that kind of classroom piece. Where is she succeeding? Where are those kind of glimmers? In terms of responding, clearly have a conversation with mom. It seems like some of that trust has been ruptured, so rebuilding that relationship, of course, trying to align our response. Support them in returning to school. Sounds like there needs to be kind of a plan in place. A lot of that is going to start at home, before she even comes back into the building. And then figuring out what supports she's going to need in school. And then obstacles, it sounds like probably going to be several. I think some obstacles will be helping teachers kind of respond to these kind of behaviors that they're seeing. Like we said, the parent piece, we kind of have to fix that relationship. So those were just some of the conversations at our table.
Thank you. Beautiful. I'm sure. Do some of you all resonate with some of those things? Yes. Thank you. And Anthony and Nez, I'm just going to have you come up first. So you. Okay.
Well, I want to piggyback
From
on
Ohio.
something. Oh, from Cleveland, Ohio. Performance Academy. Well, I'll take number 1 and I'll take number 2. My colleague will take 3 and 4. Well, one thing that we discussed was that the first thing that we would do was, what was the antecedent? What past records do we have? Let's think about, did it happen before a certain event or after a certain event? Was any of the documentation that was done before this that we could bring to the table? Second thing that I would do would be, how would we respond? Well, we would respond by creating a crisis team. Is there one in place? If it's not, we'll create one. Invite that person to the crisis team, to our team meeting, and look into the previous school. Was it a previous school that they went to? Is it a individualized educational plan that we could use that as leverage and data to bring it back forth to? And definitely we want to support the parent. We want to really support the parent with this evidence and this information to make sure that we want to make sure that all students receive a high effective educational.
Thank you. Beautiful. Wait, before you say that, I just want to say that whole idea of antecedents, with the incident reports, sorry, you can just hold that, just because it'll echo. With the incident reports, I often encourage schools, when I have my other hat, which isn't on school avoidance, but around threat assessments, is how important it is to have the antecedent on the incident reports. Often what we have, if you take one thing home to your school, take an incident report and put on it antecedents, because in the heat of that incredibly rattled kid, the focus was on everything that had gone on in the moment that she was being combustible. And so I love that you highlighted the idea of thinking about the antecedent and mobilizing a crisis team, because school avoidance is a crisis, but it often gets overlooked as a crisis sometimes because they're not there, right? So it's easy to sort of get lulled into, especially you sort of have a vacation if it's an aggressive, assaultive kid that just disappeared. You're like, okay, so yeah.
So with how we would support the student in returning to school, as Tony said, we would want to create a crisis and a support plan. We would really want to focus on the entry of the student. So what time they're coming to school. So maybe they have an adjusted start time to where if we know these behaviors are coming, we're not doing it as the same time as 200
Beautiful.
other students are coming into the building as well.
Yeah.
It also noted that she was bilingual. So we thought that maybe there was a language barrier that may be taking place. So making sure that a part of that entry is somebody available who speaks to that student can clearly communicate with, and that person can clearly communicate with us what that student's needs may be. Also making sure that, I think with the point that we have, we want to try to reduce the restraints.
Yes.
Because with that student coming and constantly having to be restrained, that in and of itself can either be the trauma or cause another trauma that would continue to add to the avoidance of the school. So we want to make sure that those things are in place and are in mind as we're creating that support and that crisis team for that student. And then I think the main obstacles would be that it takes time. So if a student has been coming with these behaviors, we're not automatically going to put something in place and then they just stop. So we have to make sure that we're, and whatever team is in place is persistent, and making sure that we're taking cues from that student to see what's working and being able to adapt that plan as necessary for that student. In addition, the parent seems like she may be an obstacle because she may have some adverse feelings about what's already been happening per her email, about how she doesn't feel supported or feels like she's getting blamed. So we want to make sure she doesn't shut down and it isn't available for us when we need her to be there to help us support her child.
Okay, I just want you to say, you were saying, I don't know if I can get up here and talk. Look it, do we have wisdom in this room? Wisdom, all of you. I mean, all of us, right? We've got about 4,000 years of wisdom in this room. And one of the things I thought about tagging onto what you said is, and it's in my slides, but I'm just going to skip ahead and have it as dialogue, is school culture is something we miss sometimes. And when we are restraining kids for that long, we've created an own separate trauma. And that's something that doesn't always get addressed. There are sometimes school adults that will escalate. Not a lot, but probably 10% in a school building. And sometimes they may be in situations where the response makes a child frightened because they're not coming from a calm place. They're coming from their own sense of adrenaline. So really being able to settle ourselves down before we go into an interaction, particularly with a kid who's as aggressive as this. This is scary. If your arm is being hurt, those are tough situations that are going to make you maybe get a little bit more combative. So having us think about really also, Dan Hughes has a concept called tagging in, which I really like. It's the idea that you build in the culture a sense that that it's allowable. If you see me escalated, that we have a vocabulary before a crisis where you're like, okay, Anthony, well, you'd be doing it to me, so you'd say, okay, Nancy, but how about I'll take this from here? And sometimes we don't do that. Sometimes we are, as staff, passive bystanders. And we can see something that we know may be the kernel for something like school avoidance, and we may the culture isn't allowing us to feel like we can be fallible. We can make mistakes. It's okay. There's a guy who wrote a book called The Human Side of School Change. Evans is his name. And he had in one school that there was a plunger award. So a staff was actually given a golden plunger when they made a mistake as a way of sort of privileging it, right? So, Andrew, can you finish it up? Let me just give you this.
Thanks. Hi, everyone. My group talked about a lot of the same things that these folks were talking about, both around the students coming to school, what the antecedent was, what kind of different setup we can have for that student coming to school. Outside of those specific things, one thing that we talked about was the parent's email actually is a real gift to the school to have like that much background information about how the parent is feeling before they're coming into the building. It's great that they have someone in the school community that they feel safe saying that to in an email and trying to get some advice from, I'm not sure who the email was sent to, but that information for the school team is like so important, both as feedback for how they might be making parents in their community feel, and also grounds to work moving forward to build that parent connection, and how important, it seems often like in school refusal, the school wants the parent to be doing more and the parent wants the school to be doing more.
Yep.
And they can, battle in that way. But I think the partnership is what's really important. So that information on the email was really useful.
But what a beautiful way of turning it around and thinking of oppositional parents or parents that are pissed as a gift. Like, you're giving me some information about how, and you said this also, about how we as a school may not be meeting your needs, and how can we flip that. So thank you, you guys. I really appreciate it. And we're going to, yes. Good. Really, they said everything that I was going to say to you, but I think I just want to share with you a study that I thought was really interesting. It's by a psychologist, Havoc. It happened in Norway. I don't know. Everything that's about schools seems to happen in Norway, like always his curriculum. And he looked at 6th to 10th grade students, 5,500 students, and they talked about non-attendance as being 10 days of not attending school in a 3-month period. And what was most interesting to me, this is the take-home point of this particular study, if you think about anxious kids, is that the kids that stayed home were the kids who watched a teacher who was harsh in their management of a disruptive kid. And the anxiety they had that they might be the kid reprimanded is what upped their anxiety. So that's a take-home principle for us. Not like PRINCIPAL, but principle. It's a take-home lesson, which is, I think, if we're looking at school-avoidant kids, a lot of times we look at it as district-wide, and we don't always look at it within the school, and then look at it within the classroom. And it may be also a flag for when a teacher may need extra support around management, and not only be looking at the kid who's avoiding school, but to be looking at the disruptive kid and how that's being managed. That's why I shared this slide with you. And then just the idea of all the different ways that we already heard about where bullying can happen, and that's associated with school avoidance. So we talked about Jeff Perotti's work, Perotti, and he has, through the Department of Ed, with 120 people from you who are from Massachusetts. I've often had LGBTQ kids avoid school because it doesn't always feel safe, especially with transgender kids. If they're struggling with being misgendered, they'll sometimes start to avoid school. And he is a resource and a free resource in being able to help schools manage LGBTQ and setting up a good climate. So in my work on doing safety assessments, all of the Safe School Initiative is about focusing on the individual. Her work is really working backwards from a completed school shooting and looking at the school culture. And I certainly found myself thinking about that with the 6-year-old who shot his teacher, that there were things that you could read between the lines about the school culture. And I'm just adding that in for us to be thinking about with school avoidance. And what you want to think about is, as some of our participants talked about, is this a culture of caring? Or is it a culture of judgment where students feel blamed? And does the climate allow for mistakes? So if you see a colleague that really is struggling with the management, have we created an environment that actually allows us to give suggestions? And so there is, she's from Colorado, and there is a survey that they provide for all for schools outside of Colorado. And I just like the emphasis on some of the questions about would kids and staff report anonymously if there felt like there was unsafe behavior? Do we have a mechanism in our school where that can happen? And do we have a sense of efficacy if that's reported? And do we have a clear vocabulary and action plan about an event of an emergency? I now have added to my repertoire how to respond to emergencies, but let me just briefly tell you what worked with Jenny. One of the things was, this gerbil will make sense, I promise. The functional behavioral analysis was done, and it showed no pattern of escalation. And I wrote a book with Jessica Minahan about that, and she was a behavioral analyst. I wanted to know, how do behavioral analysts make sense of things? Because it seems like it's attention, escape, tangible, and now I've forgotten the fourth one because I don't have my slide. I think what I learned from her was the idea that anxiety doesn't have a pattern, and that it can seem like it comes out of the blue. And that someone had asked about, well, I want to know about the previous relation, who was this child prior in other school events? That sometimes gets missed. I've been asked to, I had a kid who was at home where there was a question about whether he was a sexual predator, and no one had reached out to the prior school because the parents were in such shame, which we heard about, that they weren't giving permission. And it was so important when I got that information, because the middle school principal was like, I don't know what kid you're talking about, because this kid was such a star in our setting. So it allowed us to sort of step back and also help de-escalate the situation. The school was prepared to do a 45-day assessment. That would have been a tragedy for this little girl who was in first grade. And yet we find a lot of kids who have escalated behavior get sent to 45-day assessments. And it means we're sending traumatized kids away at a time when they're being a porcupine and we need to pull them in. So I reached out to the pediatrician. That's another untapped resource, because there got to be a mantra to give medication. And she was like, I don't understand the kid you're describing. This is not a family that's dysregulated at home. And we were able to kind of address that and move on. The gerbil was that the family was really attached to the behavioral analyst who had worked with them the year before in helping with some of the anxiety. And she did an inventory of interests that Jenny had. And one of the interests that Jenny had was a love for gerbils. So, building on islands of competency, they anointed Jenny to be the person who brought the gerbil she brought her home and then brought her back, brought her home and brought her back. And that was sort of became her transitional object to get her in the door. And I wanted to highlight the really smart suggestion that one of our participants said about thinking about the staggering of time and the fact that maybe we don't have her come in right at the time when everybody is trying to settle the whole school, so we can give her some transition time. I'm just going to end with how are we doing with time? Terrible. Email from Jenny's mom. The bus stop couldn't have been arranged better by Hollywood. We met Anna at her house and walked over to the bus stop together. Right as the bus pulled up, Anna starts to cry. She has not been loving the bus. Jenny started patting her shoulder and saying, "It's all right, it'll be fun." Anna's mother pulls her hand away as Anna gets on the bus. And right as she drops it, Jenny reaches out and takes it and says, "Come on, let's sit together." The transition has now become a much more stable thing. And of course, Anna's mother looks at me like I'm crazy to think Jenny is the one with separation issues. But really, who better to walk a friend through the sadness of leaving your mom? Have a great day, everyone. So, very cool. Okay. Yes, thank you, Miriam. We're happy. I like happy endings. Okay. What key decisions, I'm going to whip through this, do schools need to think critically about? And again, this is just to bring back to your attendance folks, and it's come from me talking about school avoidance. Folks have shared this kind of thing. First of all, I think it's a bust. Oftentimes, we get into these buckets of excused versus unexcused absences, and I would encourage you just to look at absences. And that's what Kearney says too, so I feel good about saying that. And that's because sometimes parents are enormously resourceful in excused absences. And so we want to just pull those together to be able to think about it. Always the question is how much to modify work expectations and how much to allow them to catch up. And that's another $1 million question. Whether to fail for absenteeism. If you can influence your administrators, if you fail a kid, even if it's in March, then there's no incentive for this kid to come to school. So it's a total bust. So however creative you can get about giving some kind of credit to keep them on the edge of movement is really important. Participation in extracurriculars, if poor attendance, that's sometimes really tough with sports. I've been down to whatever that building is where you make appeals for kids being able to play sports. But I think it's a really, we can get into a punitive stance, and it's just a decision. I'm not saying, when yes and when no. When to intensify services and what services are available is another huge question. The timetable. What criteria for sending to the emergency room? Children's Hospital has some really good criteria that I'm just going to share with you, and I'm going to talk slowly for you guys to think about adding so that you have a shared vocabulary about what criteria you send to emergency room. Because again, across schools in a same district, you can see fluctuations of the threshold for sending a kid to an emergency room. The criteria that Children's Hospital offers is suicidal or homicidal thinking or behavior, psychotic symptoms, a sudden change in an individual's mental status, anxiety or mania, and extreme behavioral distress, escalation of behaviors. And when you call the parent, it's really important to give the parent observable behavior. That's really important. And also, and again, you've heard me say this before, but to give, if you're not going in the ambulance to the emergency room, to give someone a cell phone after hours from a school person, because otherwise what happens is you have a kid show up in the emergency room, they've completely de-escalated, and you're screwed, basically. Okay. The timetable of when to rip the Band-Aid off and coordinating with outside providers, I've seen that be a place of a murky area where again, Kearney recommends a month. We really ought to be picking up the momentum. Sometimes what happens is we really lower the expectations. We don't end up doing any kind of exposure. And then the kid just kind of stagnates and doesn't end up really moving along. And the other thing I recommend for the 20 nurses that are in this room, a lot of physicians are putting letters with no expiration date. That is a kiss of death for a school avoidant kid. And what I would recommend is having a group of pediatricians, if you're, say, in Winchester and there's a couple of pediatricians, that you have a Zoom call with the pediatricians and you help, 15 minutes, and you help explain why it's really important to have a time date on a kid that's staying at home or talking about not being able to come to school, and then doing a reassessment. CRA, probation officer, child requires assistance, that's the language we use. I find that you don't get much leverage from having probation officers unless you have very permissive parents. Sometimes that might give you a little bit of leeway, but I also see it as a class difference. I think white kids who have an access to a lot of therapeutic services often never get probation officers, and kids that are immigrant, whatever, a range of diverse students end up being the ones that are more likely to get a CRA. So, hold on. Yay, okay, this is just some other quick things to pass along to you. Some of you were at the, know about Todd Rogers' work if you've been at the seminar before, but Todd Rogers looks at how we communicate with parents on a systemic level. This is called the black hole because it's really hard. I don't know if any of you try to get medical records and they tell you to give your password and you're like, oh, forget, I don't want those medical tests. This is like a hurdle to get to. This is how New York City used to ask people about how to access absenteeism. And Todd Rogers, who's out of the Harvard Kennedy School, and you can look him up, came up with a much more seamless system to be able to reduce the friction so that parents can get access to when their kids are missing homework, whether they've missed a class, and if they're falling below grade. And then they also made it user-friendly in terms of telling parents where their kid falls in comparison to other kids in the district. How much school avoidance dropped? Just yell out a percentage. 2%, let's say. Raise your hand if you think it's 2%. 4%. 20%. Okay, it's 10%. Okay. Check and Connect, I just am telling that there may be some districts that use it. It comes as an app, and it's around an engagement intervention, and it's based on basically trying to develop a trusting relationship with a mentor, and it monitors for checking on absences, behavioral referrals, grades, and they're supposed to connect by personalized interventions and build constructive school-family relationships. What I find fascinating always in these evidence-based treatments is they always look good in the first round, and then you do them again and you get them into bigger studies and they don't always work. And in Check and Connect, I think the two concepts I want you to take away from it is it initially did really well, and then when it started to go into larger districts where there was a lot of say Worcester, where maybe people are changing from one district to another, they sort of fell apart because the mentoring relationship was harder to maintain. But I like this teaching point, which is they have a monitoring, and frequently with school avoidance, I tell you, I have so much respect for educators. You all put in like 190% sometimes with these kids are missing, but you don't document. And then it may end up that a kid gets hospitalized, and I'm ashamed of this, right? Psychiatrists will say, we think this needs to be an out-of-district placement. Clearly, you guys aren't doing your job. And you're like, what? That is not the reason, and you have a bifurcation. So you have a school-avoidant kid who may get suicidal or may get aggressive at home when the parent's trying to increase the heat. Please make sure you document. And the kinds of things that they document that I just would run through: academic data, behavior data, communication in terms of phone conversations, home visits, attempt not reached, and informal and formal. And then discussing current choices that may impact graduation from high school, problem solving with parents, facilitating participation in community service, facilitating tutoring, teaching organization and study skills, and arranging alternatives to suspension. So that's a level of granularity for when you get into a pissing contest, because we all know, if we work for special ed, that the big dilemma is if you do an out-of-district placement, the million-dollar question that I'm often asked to come in and help out with, you may end up having a kid that doesn't go to school and you're paying $80,000 for them not to go to school. So that's what we're trying to be able to build the data to not be in a contrary way with outside clinicians. All right, so now we have Ahmal. And I'm going to tell you about him. I'm going to ask you the same questions, and I'll put them up on the board. You all are going to have a chance to discuss. Then I'm going to have Marc Banks, who's the administrator, come up and share some of the things that he might think about it, and also Liz Jorgensen, who you may have heard talk, who's going to talk a little bit about, I'm not going to give it away, and Jennifer, a school nurse. So here's the case. I want you to think about it. You ready? Put your thinking cap on. Okay. A 16-year-old senior from Pakistan. Freshman year, he participated on the football team and did relatively well in school. He dropped out of football after a concussion. Junior year, he was caught plagiarizing another student's work. Beginning of senior year, he had a physical fight with another student who called him derogatory names. Has missed over 30 days of school this year. Complained of headaches and stomach aches. And his mother suspects that he is smoking marijuana daily. So, I want you to think together for 6 minutes. What's going on? What additional information do you want? How would you proceed? Spend more time on how you would proceed. And what, because oftentimes we spend a lot of time on information. And how would you proceed is the golden question. And what obstacles do you foresee? Thank you. 6 minutes. So we have a guest here who, you know how you meet people who inspire you? I mean, that's what's kept me working with educators over the last 25 years, is I meet people and I'm like, you all give that extra mile. So, Marc Banks works at Newton South. He's a dean. I've been working on a very, very difficult situation for a year and something. Mm-hmm. We're making small progress. He's making small progress. And I was thinking, how can I have a talk about school avoidance and not ask him to share with you some of the things that I'm learning watching him really give the extra. That's what Marc's here for. And I'm going to just give you a couple prompts because I'm going to give you a couple prompts. So Marc, can you tell me a little bit about connection with boundary and the kind of effort you make when you have a student, he's a high school administrator, a student that's missing school?
So, hi everybody. It's been an interesting year and a half. So this student is a 10th grader, and he is just starting to come back to school, but when things first started, one of the things that I heard from mom was that she felt like she was not being heard. And so through the middle school, I mean, he essentially stopped coming to school when the pandemic started. So when you think back to March 2020, and this past month was sort of like the first month where he's been to school since February of 2020. And so she had said that no one's listening to her. So I figured, I'm the type of administrator, okay, parents, that she's being mama bear, how can I help her feel heard? And so I said, all right, I'm driving to school, I'm sort of a captive audience, I will call her on my drive to school in the morning. And so every morning,
single day,
on my drive to school, I would give her a call to check in on him and then just to speak to her to hear sort of like what's going on today, what's going on at home. And so I was telling Nancy, there was a moment where, sometimes the call would drop. And so she did ask at one point, like, oh, it'd just be so helpful if I had your cell phone number. Because I was calling from my personal cell phone. We don't have work phones at Newton South, thankfully. And I did not give it to her.
Yeah.
So I think it was still, and she was totally okay with that. But, knowing that I would call every day, that was just one of the first steps in helping her feel heard. It's amazing. Like that alone sort of lowered the temperature and her feelings about the district, just sort of reaching out on this daily basis.
So you all can hear embedded in this, he's talking about almost a year and a half that this child did not come to school, right? So I want to ask you about perseverance and how do you stay in the game?
Yeah, so it's not a one-man show. I'm thankful to have a really strong group of guidance counselors, school adjustment counselors, and even his own outside team sort of working together in this. And so it's just, this is my 18th year as an educator and 11th year as a dean, and it's always been, I know, 17 to go. Not that I'm counting down.
I'm going to bring you over here just because I keep looking at my notes.
So it's really about sort of that connection to others and sort of just checking in every day with them. The way Newton South is set up, the guidance team is actually in the same office suite as me, or as I am. So it's that consistent checking in with them and knowing this is not just me doing it by myself. So, it's at the point too where the guidance counselor will call, my secretary will call.
Shout out to secretaries
Oh
in
my
this
gosh,
world.
thank God. Yeah, for all the administrative. She likes being called secretary. It makes me uncomfortable. She's like, I am your secretary. So she's part of the team. And so this student has also connected with her.
And you've done home visits?
And I've done home visits, many, many, many home visits.
And part of what I was talking to Marc about why I wanted him to be here is there are about 10 administrators here, but I think sometimes when we are school counselors, school psychologists, school psychiatrists, we kind of privilege our role of building a relationship and don't always do inventory of leveraging other people who may also be able to make a strong connection and may even, and we talked about the dynamic that Marc kept looking to outside folks to tell him what to do and is now increasingly taking ownership. And it can be a parallel process for the parent that as the educators start to think, okay, I know what I need to do and I'm going to step into this, that also that gets mirrored to the parent.
Right. I think I trust the psychologists out there and knowing sort of, that piece of the brain and how it works. I think what empowered me was because it's such a relationship, the student winds up trusting the people that he sees the most, right? So it really became, all right, so I'm going to come up with this idea, run it by the psychologist, run it by the guidance counselor, run it by the school adjustment counselor, and sort of see what's working, run it by Nancy. And so Nancy's also given me the, like a bird that's being set out of the nest, like go and do it. And so I think it's interesting. I have another student who's in a very similar situation, and so much shortened timeline now that I've sort of experimented with this particular student, by far the hardest student I've had in my 11 years as dean, but I'm sort of taking those skills and sort of, okay, I know, try this, see if it works, try this, see if and it's gonna be a ton of failure, but knowing that these particular things work, the second student is actually
moving faster.
Moving a little faster.
And having the culture of mistakes. Like,
Correct.
It's okay. I can make a decision. It busts. I remember us having the discussion about should we fail, should we not fail? And so could you talk a little bit about rupture and repair?
Oh, yeah. So I think one of the things that it's been an interesting year and a half, 2 years with this parent, because when I was calling every day, clearly she had her feelings about the district, and I heard those feelings loud, and I'd have to turn down the car volume. There were times when she and I would get into it because I wholly disagreed with her viewpoint, especially as a ninth grader. The middle school is different than the high school. I'm a different administrator. And so, we would have all-out arguments, and I would still call the next day. Mm-hmm. And so I think just her knowing that even though she could yell and I'll use the word yell back, that it was still a continued conversation, because at the end of the day, it's about how do we get her son back to school? That's what I was most interested in. There was a lot of ruptures and a lot of repairs, but now it is at the point where it truly is a back and forth dialogue.
And I think that's, when we talk about attachment-based family therapy and Guy Diamond's model, it's about rupture and repair, and being able to model that you can have conflict. And I think that's something, again, when we're talking about working with parents, a lot of us, including myself, are aversive to conflict, and we're going to go into fight or flight mode, and being able to really stay solid and move with the confidence that you can manage the conflict and repair it, I think is really important. And
I think, Nancy, if I could also throw in, when we first met a year ago, one of the first things you said to the mom, to the team, was based on what you were hearing, this is going to take 12 to 18 months. And I remember that scaring the crap out of me when you said that. But it is true, right? So I said, okay, if this is Nancy Rappaport. She's saying it's going to take 12 to 18 months, and sort of thinking about that. And it really is, if you build, I feel like everything's so relational. If you build the relationship, the parent will come along with you.
Well, I think about it like when we think about attachment, we think it's 18 months that it usually takes for a toddler to kind of really have super secure attachment. And that's the model I've used. And I've just seen it's really helpful to take that. And Poland is much smarter than us. I did a tour around the behavior code in Poland, and they actually have paraprofessionals that stay with one class from 1st grade to 8th grade.
Wow.
So they have 8 years. Now, it's trouble if you have a bad paraprofessional. But so getting back to this case, can you talk a little bit about that M word?
Yeah, so one thing that the Newton Public Schools does that Framingham, so I was an English teacher in Framingham before I moved to Newton.
Shout out, there's some Framingham folks
all right,
here.
Framingham folks, all right. And so Newton has something called an M grade, an M for medical. And so one of the things that has helped many school avoidant kids is there's this anxiety of how am I going to catch up with work? I've missed 3 months. What am I going to do? I'm thinking of the second kid that's starting to come back. And so we have something called an M grade, which is different than an I, an incomplete. In Newton, as long as we have documentation from therapist, doctor, anyone, we can essentially forgive a term. So what we do is we assign an M in a particular term. We have 4 quarters or 4 terms. And what that says to the student is all the work is forgiven, right? So what they can do is sort of audit the class, depending on where we are in the term, to come back and just sort of be there, still take the tests, still take the quizzes if they are able to, but the grades do not count at all. And so for the student, that's sort of saying, you can come back, there is no stress about the grade whatsoever. And then what teachers do is they'll take, let's say it's term 2 with the M. So they'll do terms 1, 3, 4. We're moving away from final exams, which I really appreciate, but whatever the final exam grade is, and then do that grade calculation. The M has been super helpful for students because it's just like, all right, it's easier. I'm an English teacher. It's much easier in English and history. You don't need to know the previous book to work on the next book. In terms of math and science, the math and science teachers at Newton South have been, and I imagine Newton North, have been really good about figuring out, okay, none of this counts. Here are the fundamentals you need in order to understand the following concepts, and just work on these things. So they've gotten so used to paring it back. English and history, forget the books. Let's move forward.
How many of you have M in your districts? Oh, we have a couple, but not many. So that's good. That's great to pass that on.
Awesome.
And then can you tell us a little bit, in our case, we had about the situation that there were some derogatory comments that happened that ended up precipitating a physical fight.
Correct.
And could you share what your school's doing and just how you might think about that?
Right. So Newton South, the deans, there are 4 deans in Newton South, so each of us have about 500 students. We've always never understood the out-of-school suspension. It's like go home for 5 days and take a vacation. So we've been moving more towards a restorative justice model. So when physical fights happen, when really we could use restorative justice for anything, we actually have started to impose that model in terms of having students sit down. It does take a lot of work, and of course, both students have to agree to it. But Massachusetts, for those of you who are in Massachusetts, recently changed the suspension laws. Actually, November 8th is when they changed the suspension laws. So you now in Massachusetts cannot suspend a student. You can still suspend for the big things, right? If they bring a weapon, if they get into a fight with a teacher, assault a teacher, or if they bring some sort of controlled substance to school. That can still lead to a suspension. But otherwise, the only way you can suspend a student in Massachusetts now is if they present a major bodily harm, and that word major is so loose, to anyone, to themselves or to others. So even if they've gotten into a fight, let's say in most kids, it's usually a one and done, like he said something and I got into a fight. You cannot suspend for that anymore. So thus even more reason to move towards restorative justice. The suspension can only happen in Massachusetts after you have documented that you have used several, and our school lawyers are like, well, what does several mean? But you've done several interventions before the suspension. So thus pushing us even more towards restorative justice.
Anything I haven't asked you that you'd want to share with folks?
It's hard. It's hard. There are days, and I know one of Newton South School adjustment counselors is here, but there are days when I just go into the guidance counselor's office and I was like, I don't know if I could do this anymore. But then I just say to myself, like, this is why I do it. I love it. My philosophy of administration has always been meet the kids where they're at. So I'm just a very relational person.
Can't we see?
So that's sort of how I drive. So I would say, like, it's going to be hard. And if you're thinking to yourself, like, now I have to call a parent every day, that is not necessarily, like, you can't multiply that, right?
You can do like one.
You can do
one
every 2 years.
Yeah.
But it's something like, if you are building that relationship, I don't have kids. I'd say to my husband, I have 500 kids. But if you build the relationship, the parent will come. And my philosophy is always, like, the parent's just doing what they think is best for their kid, right? If you can look at it through that lens and say, okay, if they're coming to you with some sort of problem, it's either a need that's not being met or a skill that they have not learned. So how can I either help them meet that need or build that skill? That's how I approach it.
We're so grateful.
Right?
Thank you. Be careful on the step there. Okay, Jennifer, you want to come on up? Oh, Liz, I guess. Okay. So Liz Jorgensen, you all may have seen her. Come close to me, though, Liz. Close colleague and has spoken here at this conference 2 times. She's just going to talk about substance abuse because there was substance abuse in this case, and I recruited her to sort of talk about that.
About half an hour ago, I got recruited.
That is not true. I gave you dinner
I
last
dressed
night.
for the no, about an hour. Last night you mentioned it. So, thinking of Ahmal, there's so much information I would want to know. I'm sure you're all thinking that. But raise of hand, how many of you have seen an intense disruption related to the high potency THC products, either the vaping or the edibles, out of control? It's really bad. And we've seen, I own an outpatient treatment center. We never hospitalized any adolescents for cannabis related issues until about 3 years ago. And we probably hospitalize 1 a month now. And the reason being the potency of most of the products that's available, and the legal products as well, is so much higher than what was available for previous generations. And parents often negate the intensity or the impact of the weed relative to what they may or may not have inhaled in the 80s or 90s. So I would want to know that. We also see often teenagers who become cannabis dependent have experienced concussion, which can, as we know, biologically create some of the biological mental illnesses. So I'd want to know about that. And the way I engage young people around, especially the high potency substances, is, so if I don't work in a school, I used to run a program of school-based counselors. 2 of my long-term employees are here. So we would do home visits sometimes and just, in a relational way, talk to the teenager. And the first question that I always ask, and I would say ask this as a school counselor to the teenager, is not how much are you doing or what are you doing, but first of all, how old were you when you started smoking weed or eating it or vaping? And you do have to ask if they're vaping weed because they won't really describe that. And then I ask, what do you love about it? What do you love about the cannabis? So that's what I would ask them all in a home visit. And generally, if you ask the young person what they love about it, defensiveness drops. They don't think that you're going to discipline them. And then generally, they'll tell you about the interaction between their distress and maybe underlying psychiatric symptoms and the weed. And just, I want to say a quick thing. I love the idea of a plan in place and coping ahead. We've helped many, many teenagers since before COVID, but during COVID, come up with a strategic 1 hour in the building at the guidance department. And even if they're still using pretty rapidly, saying like, okay, you're telling me you don't need treatment for that outside the school, but let's say if you can follow this reentry plan, which is systematic desensitization, basically a little bit of exposure at the time, you'll be telling us by your behavior that you're right, we're overreacting to the drugs. However, how about this? If you're not able to follow this pretty slow reentry plan, maybe you'll be telling us by your behavior that the substance use or the psychiatric issues are more than you can handle without outside treatment. Because I don't know if you see this, Nancy, but often the parents would like outside psychiatric treatment and the young person refuses. So that's one of the ways that we engage the young people.
So piggybacking on that, just one last question around motivational interviewing.
Yes.
If you can, and raise your hand if you know what motivational interviewing is, great. So just walk us through your 3 favorite questions if you've got a kid in either pre-contemplate, if we move through it and we don't know where Ahmal is, but just plucking 3 questions. Say, I'll help cue you up.
Okay.
Rolling with resistance.
Well, I'm going to assume that every teenager is resistant to even talking about their substance use. But I do find, and I've done like an all-day training as a participant in motivational interviewing. The tone is so important. So you kind of have to ask questions in a very blasé manner.
Yeah, like Columbo.
Like Columbo, exactly. Like Peter Falk. They're all too young for that.
Okay,
though.
but you
They
never
don't
know.
even that. But you just go like, oh yeah, well, how long have you been using opiates? Hey, when's the first time you actually took your grandmother's medication? And you have to be you got to roll with it. And even if the young person tells you startling information, you kind of have to just roll with it. With weed, I ask a couple questions that it's not quite motivational interviewing, but is high yield to hook them. Where I'll say, have you had any weird symptoms like throwing up in the morning when you don't have enough weed? And they'll go, yes, because there's something called cyclical vomiting syndrome when the young person is highly addicted. And the other motivational, if they're pre-contemplation, the motivational question is like, hey, is there anybody that's annoyed with you about, how much you're using and how does that go down? And that's very high yield. Oh yeah, my girlfriend, my mother, my father. And generally, I find that most teens who maybe have made it as far as Ahmal, they kind of know that the substance use is contributing
let's move to just one last one.
Okay.
If looking at discrepancy, like the discrepancy of what they want and what they're doing, and how do you leverage that? How would you talk to Ahmal? You say you want to be a pediatrician.
You owe me one after this one so
That's
bad.
it.
Okay, no, I'm kidding.
I promise.
I'm just nervous. Okay, so how would I help Ahmal get from contemplation to action, you mean, or pre-contemplation? Okay.
Yeah, let's go to contemplation to action. We like that.
So I pick a small thing. I'll say, would you be willing, you're telling me now that you use your vape pen 10 times a day, which is not unusual. That would be equivalent to smoking about 6 or 7 grams of weed a day. I said, could we work on you just smoking after school? Would you be willing to be able to, just for a little while, and even if it's 10 times after school, Ahmal, would you be willing to because you can't go to school intoxicated, that might be part of your resistance. That's what I say. So with motivational interviewing, you also speak out loud to what the motivation might be, but you got to do that Columbo thing, like, gee, I wonder if, since you need to smoke, you tell me you need to smoke 10 times a day or vape. So then you can't go to school intoxicated and everybody can tell. So would you be willing to just wait till right after school to start? And a lot of times the kids they'll say yes because they realize it's not an unreasonable request to not start at breakfast. You know what I mean? It's like, it's kind of like, could you start after lunch? And then you go from there. And then I also say to young people, I say, listen, and if you really mean this new rule that you're only going to smoke after school, you let me know if you can't do it, because one of the things we want to see is if you make your own rules and break your own rules, that means you might need a little extra help, because I see you would sincerely want to follow this new rule of only smoking after school. And wow, that must be really hard if you can't follow your own rule.
Thank you. Awesome. Wait, you can bring that with you.
Okay.
Watch out on the step. Okay. So we're going to have one. This is just in your records about this was from a talk last year about good screening instruments to have. So you have that in your slides. That was just something I wanted to give you as a reference. And hi, Jennifer. I'm just going to say one thing really quick. One of the problems, she's a school nurse. Yay, here for school nurses, and especially around school avoidance. That we heard that he had a concussion, and one of the things that we run into with school avoidance is how kids come in with somatic complaints, and the parents end up saying, "Okay, little Johnny has to stay home because he has a headache," and getting really clear about what the criteria is for a child to stay at home. So severe flu-like or asthmatic symptoms, severe diarrhea, bleeding, frequent vomiting, and temperature more than 100, so that we get out of the slippery slope of staying home. But you are a school nurse and have a lot of experience being in school. So I thought we would take a moment just to have you share with us thoughts you wanted a diverse group, but many of us being school counselors, psychologists, and social workers about some important thoughts.
So Nancy didn't ask me to speak last night. She asked me to speak at 8:15, sitting back there at a table. So I have some thoughts. They're random.
About me.
No, they're random, so hopefully it'll all tie together. But I wanted to start by saying school avoidance starts in preschool. It starts with episodes, and then episodes become, a little bit longer. You might see school avoidance. I'm asking you to think more broadly about it. Is it the kids that come in tardy, so they're marked for the day, but they didn't get first period? Kids who are not in class because they're in the bathroom. They're wandering. They have break times built into their special ed plans. If you are in elementary school, do you know how many times you have to put Vaseline on chapped lips? And think about all those visits with chapped lips and paper cuts, and I think I might throw up, which is really popular around math test time. Or I played basketball and my knee hurts. I think I have a bruise. When did you play basketball? I think it was last week. And so these are all the reasons that kids raise their hand, they leave class, they come down, and then it is one giant black hole sometimes for a nurse's office, and it becomes a rabbit hole, and then they sit there and they listen to everybody else who comes through. And school nurses are charged with time out of class. And so my heart is racing to get this fearful child back to someplace they don't want to be, because my job after the Band-Aid or the ice pack is to get them back to class. And recently I was part of a 504 meeting where a student was denied services because the attendance was so poor that they couldn't prove that she couldn't do the work. So it's a cycle that I'm pleased that nurses are being included in. But if you have concerns about your kids, reach out to sort of the medical silo and say, can you help us? Call the parent. Oh, yes, death. Death to any child staying in school. Mom says, usually in the car, while they're eating an energy bar, if you don't feel well, go to the school nurse and I'll come and pick you up.
Yeah.
So temperatures over 100 are real. It's usually, for any age group, 24 hours, fever-free, vomit-free, without using medication. Parents aren't always on top of that. So you get these prolonged fevers that are now being paid attention to because we have this trifecta. We have sort of the trifecta of medical excuses of it might be COVID, it might be the flu, it might be RSV, it might be somebody else in the house is sick, so we're gonna keep everybody home because you still have a little bit of that quarantine mentality. Somehow I think I'm over my 2 minutes.
No, I appreciate it. I think you've given the flavor, and what I'm hoping people will our take-home message is go to your school nurse when you get back and say, hey, maybe you've already had a discussion with your school nurse, but let's come up with a plan for the frequent kids that coming down to the nurse's office so that we can allow you to spend time trying to keep kids moving a shout out, like we said, to the nurses, because we know it's been particularly stressful over the last many years, and we're so grateful. Yes.
Thank you.
Yep. You can bring it back down there. Be careful on the step, though. That's a treacherous step. Okay, cool. This is just a really great app I would recommend for you all. It's How We Feel app. It's on an iPhone, and it's really good for high school kids. And when I was doing a school avoidant talk, someone shared with me that they had noticed that the pattern for the child not coming to school is when they were depressed, but the child hadn't identified that. So this is a really nuanced way of getting kids. It's fun. It's really good graphics. It has a couple of lessons that get opened up that are evidence-based, that are 1 minute long. Once you've checked in like 6 times, so it brings out the treasure hunter in all of us. Okay, 5 minutes, I'm going to talk about family therapy for school avoidance. All right, we touched on it a little bit with Marc, but we need really trying to have a shared understanding of the problem, and that kids can't overcome anxiety and return on their own. They need systemic intervention and exposure. Guy Diamond often talks about family as the best medicine. And there is, out of Yale, there's a program called SPACE, S-P-A-C-E. It's really interesting because Leibowitz is the researcher who did it, and what he showed was, I tried to get him to come here, but there was something happening on Friday and Saturday, but maybe next year. But what I loved about it is it showed, everybody says, let's do CBT, cognitive behavioral therapy for anxious kids. But what he did was forget the kids and just focus on the parents. And it was equivalent change in behavior. So that's a really, I think, super interesting for us to be thinking about in how we reconceptualize how we approach anxious kids and look at that more closely. And so clearly what you want to be looking at, and this is for the clinicians in the room, but also I think for when we bring in our families and try to talk with them about this, is what is the way that this problem is being maintained within the family? Is it about a lack of parental consistency? Is it around that this is the identified patient, but there are other aspects that are happening? And really broadening, especially with the intergenerational school avoidance, really talking with them about, we're trying to help kids practice for life, and reframing it from being just about school avoidance. I think that sometimes can help. Some of you may be familiar with circular questions, but I like them. I find, who is the most concerned and or involved? What will happen if it doesn't get resolved? You want to tap into the catastrophic thinking or the minimizing. What will happen if it doesn't get resolved? Who outside the family is concerned about it? Sort of doing an inventory. Oftentimes parents are exhausted. Is there anybody with a heartbeat that can add energy to the system? That's what we hear about with Marc in terms of how he's generating energy for a family that's feeling depleted. What have they done to try and fix it, and how did that work? And sometimes in changing the family pattern, you can have families that feel like they are held hostage. They worry that if they actually go from being permissive to leveraging their child, that their child may kill themselves. Now, that is really a parent being held hostage. I feel like if a child says, Mom, you're making me go to school, and if you do, I'm gonna kill myself, that's room for an evaluation, for having a crisis team come out and not have the parent then step back. So problem solving with a parent about that fear factor and how to address it, I think is really key, because with these really entrenched kids, that sometimes can come up. And contingency behavior, I had a wonderful social worker tell me about an intervention she'd done with a family that didn't speak English, and they were able to come up with non-cost contingency behavior kinds of rewards. So really taking the time to do that. And this is from the adolescent substance abuse, just reminding us many times parents who are with adolescents don't think they have leverage. And there's a lot of leverage that parents have, and we want to support them figuring out how to use it. And then I just want to end with, I like sometimes whether it's you or it's the parent, sometimes you say, suppose you go to school, you want to ask the miracle question. Suppose you go to sleep tonight, and when you wake up, the problem is gone. And you want to be able to sort of, it's not only just about coping ahead, it's about holding on to the future of that student. So some of you are younger than me. I'm aging out. And so you may not have the clinical experience of seeing kids that seem intractable turn around. So you have to really use your imagination to bring that glimmer to holding on to the perseverance that's required with these students. So the last question, what will the first sign that this miracle occurred? So I have a surprise guest again here who's going to sing to us, Ashley. Ashley, if you can come up. Ashley Cooper. And some of you may remember Ashley. Ashley was here pre-pandemic. She was now is getting a master's, is going to be going to medical school soon, and I think is going to end up being a surgeon general. That's what I think. I'm going to be working for her. But she sang 4 years ago, and I asked her to come back, and you're in for a treat. And before you go home, I have a little token for you. I know you're not going home after lunch, but I'm just giving you a heads up. I have a little token for you to bring home. And I want you, can't light it here, I want you to light the candle that we're going to have for you. And I want you to see the glimmer inside of you. What you bring to your kids, to your students, is a gift. And what our students bring to us keeps us going. So Ashley's going to sing for us. Thank you. Yes. Good, beautiful.
Little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine, let it shine, let it shine, let it shine. Everywhere I go, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Let it shine, let it shine, let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine, let it shine, let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine.
Thank you. Thank you.